All right, welcome everybody. Let's get started. My name is Scott Larsen. I'm a chiropractor here at the Institute for Health and Healing in San Francisco. Thank you for joining. Welcome. I love the topic we're going to go over today, and I hope you get something out of this. This is one of the big musculoskeletal plagues of our modern society, and we're going to be talking about osteoarthritis, but you can kind of loop in any degenerative chronic condition into this discussion, but specifically we're going to talk about osteoarthritis. It's not a comprehensive guide. I'm not going to be walking you through the textbook. You can do that on your own. Go to Wikipedia, go to CDC. You can get the comprehensive guide, but honestly, when you do that, it's not completely helpful. And so let's talk about this. So osteoarthritis affects more than 30 million Americans. It's one of the leading causes of disability. And when you look at the CDC website, you're going to find that the main symptom is joint stiffness. How does joint stiffness lead to one of the main causes of disability in the United States? That's what we're going to try and tackle. Risk factors, according to the CDC, old age and obesity. Again, yes, but is that very helpful? Let's try and make this helpful. So let's respect the normal joint, okay? Let's take just a moment to just pay a little awe to the ability of our bodies, specifically our joints, to do the amazing things they do. I'm going to just do a quick covering of what the joint is. And I want you to think of like an Olympic level gymnast, like an NFL athlete, an NBA basketball player, a Major League Baseball pitcher, just the athletes at the top of their game, using their joints along with their muscles and their body to perform athletic things at the highest level. It's so awesome. I love it. So a joint, we have lots of joints in our body. It's where a bone and a bone meet. It forms a joint. There's a strong connective tissue that covers that joint. That's called the capsule. It's permeable. It can let things in and out. You've got this slimy, slippery covering called cartilage that is alive. It creates little molecules and chemicals, and then that feeds into the joint fluid, which is called the synovial fluid. And that's full. It's like a soup, just full of nutrition and, chemicals and molecules and good and bad things depending on the health of your joint. And it's all alive. Everything is alive, which means things that are alive can improve their function and get better, and things that are alive can also go the other way and break down and start to get worse. So when you think about degenerative disc disease, osteoarthritis, cervical spondylitis, all the other itises that relate to joints and whatnot, you can go two directions when you have an issue with your joint. It's not an inevitability that it's going to break down and it's going to lead to uncontrolled destruction of the joint. And that leads me to my next point. I want you to think of this. If you have an issue with a joint, if you have an osteoarthritic joint, you have to think of it not in the sense of wear and tear, but in the sense of breaking down. Okay, it's a big misconception that I don't expect to change the world's misconception of wear and tear versus breakdown when it comes to a joint, but I'm going to try. So when you have a problem with a joint, the joint is breaking down. It's not wear and tear. It can be wear and tear, but it's a breakdown process. And the reason I say that is because it's not a singular pathophysiology process going on. It's not the same for everybody. Everyone experiences a little bit differently when you have a problem with a joint. So it's helpful to think of it in the sense of it's breaking down. And why is that? Well, you have Olympic level athletes who never get arthritis, who pound their joints. It would create a lot of wear and tear. They live into their 80s, 90s, 100 years old. They don't have arthritis in the joints that they use their whole life. And why is that? Because those joints never broke down. And it's not a simple answer why it does and why it doesn't break down. But it's not a wear and tear issue. It's individualized to you. So what does a joint need to be healthy? It needs three things, three basic things. It needs nutrition, okay? It needs to eat. it needs to move, and then it needs to detoxify. Every cell in your body needs that. I don't care if it's a bone cell, a cartilage cell, a muscle cell. It needs nutrition, it needs to move, and it needs to detoxify. If it doesn't have that, you're going to get a breakdown process. And all joints need that. I don't care if it's a joint in your spine, a joint in your knee, a joint in your toe, your shoulder joint, any joint you can name or have a problem with. It needs nutrition, it needs food, it needs to move around, and it needs to detoxify. When it doesn't have that, you get a breakdown process. And the breakdown process doesn't always, but it often occurs with a trauma or an injury. This could be a major trauma, like a whiplash or a fall, or any type of major trauma, a sprain strain injury. Those are major traumas, but it also occurs with micro traumas. What are micro traumas? That's like the day-to-day trauma to a joint that inhibits its ability to eat, its ability to move, and ability to detoxify. So if you get into a whiplash type of a scenario where you get rear-ended on the freeway and you have all this pain, and maybe you have a concussion and you have neck injuries, well, that trauma is going to inhibit the joint's ability to move. And when it doesn't move, it doesn't eat. And when it doesn't eat and doesn't move, it can't detoxify. And that's the breakdown process. So that can occur on a small level. The micro traumas could be you may be walking a little awkwardly because you have a sore hip, and then all of a sudden you walk a little bit weird for the period of a couple months or maybe even longer. And that awkward like gait pattern could lead to a micro trauma to like an ankle or a knee that leads to some different movement patterns that starts the breakdown process. And so joints do have arteries feeding them blood and nutrition, but they also rely on movement because the joint acts like a pump to pull nutrients in from the surrounding interstitial fluids. So when you have an altered movement pattern, the cells, begin to break down. So that goes from the big movement pattern disruptions to the small, like the histopathology, the cells of the joint, the cartilage, the bones, maybe the ligaments, the muscles that support the joint. Those cells begin to alter and break down. And like I said, if you have a different movement pattern, the muscles that support that joint, they need the same thing as a joint cell needs. They need to move, they need to eat, they need to detoxify. And when they can't do that, your bones, the bones around the joint begin to be altered. The cartilage begins to be altered, and the soup within that joint gets to be altered, and it dehydrates. It doesn't have this thick, viscous fluid that's full of nutrition and really great soup. It's super thin soup, and the nutrition gets altered, and you have a breakdown that is a process that keeps occurring. So this process is going on. Is it going on in your body somewhere? Potentially. Would you ever know this without without an image? Maybe or maybe not. But you don't just go around taking an X-ray of a knee for no reason. Usually the story is you've got this altered movement pattern, which then starts to break down the cells, which then what happens, people? We all know it starts to hurt. We develop a pain condition. So you develop these symptoms that are related to pain, which then drives us as humans to seek help. So we go to the doctor, we complain about a stiff joint, an achy joint, a painful joint, and then what happens? Usually they take a picture of the joint. Okay, that doesn't happen right away. Sometimes it takes a few rounds, but eventually, if that pain persists, if that stiffness persists, you get an image, and the image will then dictate what's occurring in that moment. And the job of a radiologist is to point out everything that they see, but everything that they see doesn't necessarily relate to pain. There was a study where 43% of people over the age of 40 showed degenerative changes in their knee, okay? And I have a recent story I'd like to share, a quick case. I had a patient who saw me about 6 or 7 weeks after a fall, a mild to moderate fall. There was a severe pain in the sacroiliac joint. This joint was on the left side. By the time this patient got to me, there was already an X-ray taken because they had seen a few physicians for this issue, and the pain in the joint that that the patient presented with had no degenerative changes, zero. And the pain, there's two SI joints. The other SI joint on the right side showed severe degenerative changes or severe breakdown. There was what you would consider arthritis in the opposite joint. And that doesn't happen in 6 weeks. So if you fall and you get severe arthritis in a joint, that's been going on for maybe a decade, maybe longer. And the patient had never had a problem in that asymptomatic joint. All the pain was in the joint that they injured, and that's where all the pain came from. So they do studies on populations. They take images, they take MRIs, they take X-rays, and then they have people say, okay, what do you think? Here's a severe arthritic joint. Is this person have impaired ability? Is their function okay? Do you think they have pain? And it's hard to correlate the image that you see on an X-ray with how you're functioning and how your pain levels are, because pain is a very complex process. It has to do with I've talked about this before, your biology. So what's happening in the joint, your psychology, how you process the pain, how you feel about it, your negative beliefs. Some people catastrophize, think the worst thing's going to happen. Fear, depression, anxiety, stress, the loss of sense of ability and control as it pertains to a stiff or a painful joint, all lead to your experience of pain. So you want to look at having an arthritis issue, a stiff joint issue, as a whole person approach. So if anybody knows me, I like to give strategies for an issue. So I have strategies for arthritis. First of all, there's 3 things: sleep, stress, and nutrition. So this is the big picture stuff. These are the big picture strategies. You have to work on your sleep if your sleep is a problem. We want you to get over the arthritis. We want you to get rid of the pain. And so you've got to be working on sleep. Sleep is the time for your body to rest, recuperate, and specifically if you have arthritis in your spine, when you lay down and sleep and do that deep nighttime breathing, your discs and the joints in your spine rehydrate, and that's food, that's nutrition for the joint. And that the same goes for every joint. When you're resting, when you're sleeping, that's the time for your body to start working on some of these processes and dealing with the little micro injuries that are going on when you're sleeping. So if you're not sleeping well and you have arthritis, you got to work on your sleep. Number 2 is stress. Stress can affect arthritis in a lot of ways, but specifically chronic long-term stress has a whole body, a whole person breakdown, because stress releases stress hormones. And those stress hormones like cortisol do a great job on the short term to help you manage stress. But on a long-term basis, having elevated cortisol levels all the time, dealing with stress, tends to be inflammatory. It's a pro-inflammatory thing that tends to break systems in the body down. And you may be unlucky enough to have high cortisol because of the chronic stress and maybe an injured joint that's not moving very well. Well, that kind of teams up and that can lead to a process where you're breaking down in a joint. The other thing is nutrition, and a lot can be said about nutrition. And I'll just cover the 3 things that I like to think about when it comes to nutrition. So if you're eating a nutritionally deficient diet, if you're not eating a variety of foods, if you're eating ultra processed foods, you may have a problem just getting the adequate micronutrients into your system to rebuild your joints, because like I said, your joint is alive. It can rebuild itself, it can heal itself, you can get over the pain, but your nutrition needs to be adequate. So look at your diet. Are you eating a robust variety of foods type of a diet to get adequate micronutrients? The other thing is, are you eating a high glycemic diet? Are you eating lots of sugary food? Those glucose and insulin spikes are inflammatory, and inflammation in the system under chronic long-term scenarios leads to a breakdown of the body. The other thing is, nutrition is a highly individualized thing, and so you may be eating foods specifically to your body that affect your system and cause inflammation. And it could be a food on paper that looks healthy and nutritious, but when you eat it, it may lead to inflammation. Dairy is a common thing that people have problems with, and you may not be even realizing that you're eating a food like that that leads to problems with inflammation, and then chronically that can lead to breakdown. And you may have a problem with a joint. You're eating bad food that causes inflammation. That's going to lead to the further breakdown of that joint potentially. So that's the whole person strategy. You got to work on your sleep. You got to work on your stress, and you got to work on your nutrition. And the joint strategy, here's the most important part. Here's the key. So if you have a joint that's affected with arthritis and also happens to be extremely painful or even mildly painful, there's a 3-part strategy for that joint. Okay, it's really simple. And this needs to happen as often, as frequently as possible. Every day is preferable, and maybe 2 or 3 times a day to get comfort and healing into that joint. Number 1, you got to get the joint hot. I would prefer moist heat rather than like a dry heat, because moist heat is going to draw blood into the joint, fill it up with blood. And as we know, fresh blood is like breakfast. It's like lunch. It's dinner to the joint. So you want to put moist heat on the area that's affected every day, multiple times if possible. Do it in short bursts. You don't want to just leave moist heat on your inflamed and irritated joints for too long, because too much of a good thing can happen. So I would recommend 10 to 20 minutes every, a couple times a day, moist heat on your affected joints. Part 2, for that joint that's affected with arthritis and painful, is you need vibration on that joint. Okay, in order to vibrate the joint, you're going to need to buy a tool or a device, or like a little massage tool, and it can be super simple and easy, something you can buy at the drugstore or at your local big box store, but something that you can vibrate, put on the joint, and leave it on the area. What that's going to do is going to loosen up the ligaments, loosen up the muscles. You're going to get better movement, and it's going to increase your range of motion. That's super important for the joint. And vibration is super interesting. Vibration is actually one of those somatosensory inputs to the brain that we perceive and pick up on, and it travels to the brain on the same pathway as pain. And so if you put vibration on something that hurts, it travels quickly to the brain, and it can kind of override the pain signal. So if you stub your toe in the middle of the night and you rub the foot right around where you stub that toe, the pain decreases. So the same rule applies to a joint that's arthritic and painful. If you vibrate it for a few minutes, you're going to get analgesia. You're going to decrease the pain signals, as well as loosen up the joint and get it moving. And then probably the most important thing is you have to get that joint moving. A lot of literature out there, especially in the past, wants you to rest an arthritic joint. However, there is a lot of good research that shows people who are exercising, people who are moving those affected joints and getting those joints and the muscles and connective tissue around it stronger, do better in the long run. And so what I want you to do is move the affected joint through your comfort level, but full range of motion to as far as you can move that joint. Okay, so move the joint through its full range of motion to your full range of motion. You want to do this in a controlled way. So for example, let's say you have a knee arthritis and you're thinking, okay, Scott, the range of motion for that joint is basically a squat. I got to sit down in the chair and stand back up. And that hurts, Scott. Every time I do that, it hurts. Well, we got to control it. Can we modify it? Because we have to get that joint moving, because like I said, joints need food, they need to move, and they need to detoxify, and they do that through movement. And so you need to move the joint that's affected in a controlled, comfortable way, but you got to push it a little bit. So after you, let's say, sit down and stand up in a chair for a couple weeks or a month or a couple months, and that starts getting pretty easy with that knee arthritis or the hip arthritis or the back arthritis, well, then we got to add a little bit of weight. You start loading that joint up with more and more weight to increase the stress, and getting the joint that's affected with arthritis stronger and with full range of motion is going to lead to the best outcomes. So, quick recap. Arthritis and degeneration and breakdown of a joint does not equal pain. Okay, population studies have proved that. If you are affected with a joint that's arthritic and it's painful, you have to look, your strategy to overcome it has to be a whole person approach. You need to sleep, you need to look at your nutrition and maybe clean that up, and you need to work on your chronic stress. Specifically for the joint, get it hot every day. Moist heat is the best. You need to vibrate it to loosen it up and to cause some pain, reduction. And you have to get it moving. You have to load the joint with ever increasing weight to get it really strong. And if you do those things, you're going to have really good outcomes. And that's what I wanted to present today. This is not a comprehensive guide. This is Scott's guide to arthritis. And it works clinically. I've seen it work in multiple settings, and it's backed up by lots of great research. So that's my presentation for the day. You're welcome to ask any questions, and I'd love to answer a few questions.